Excited.
So I guess we can get started since you're here. I told her I would get on a little early just to make sure we're good, but can you hear me and everything good?
Yeah, I can hear you great.
Awesome. So first, we will just start off with what is your full name? Could you spell it? And then give us your title.
Sure. My name is Kirk St. John's, and that's spelled KIRKSTJOHNS. And I'm the founder of the COVID-19 Town Hall and Go to Flu program. Hey,
That's
how are you?
Photographer Shane. He wanted to say hi.
Yeah, I remember you.
Yeah.
Oh, what?
Yeah. Yeah, we got to be good friends over there at the hotel.
Oh, that's so funny.
Yeah.
I was actually working from home then, so you must have been
Right.
a reporter?
No, I was by myself.
Oh, you're by yourself. Oh, cool. Well, I guess, so we're kind of doing a follow-up today, right?
Right.
Okay, so what did you guys cover last time a little bit? So I know, and then we can,
Sure.
update the story.
Well, the last time we were in town, it was really an aggregation opportunity to bring together members of the community. For example, the owners of the hotel were there. We had a first responder with us, as well as an ER physician from the Naples Community Hospital. And our hope was to disseminate the message of Go to Flu, which is really a program that not only provides the medical aspects of the COVID-19 issue as far as telemedicine, access to testing, but it's also the first line of defense for the first responders. And what that really means is, particularly in the underprivileged or the uninsured communities, their go-to doctor in some cases will be the ER or 911, which most people are familiar with. And as much as people today understand the spread of the virus, when you're scared and you're afraid, whether that's for yourself or a loved one, you reach out for the help you know. And of course, we love our first responders. The guys are warriors. If somebody calls them, they're going to come running, whether it's a fire, a shooting, or a virus. And sometimes if we could give them a little heads up as to what they're walking into, we can, at a minimum, help them. And on the other end of the table, we can save lives. So by offering a telemedicine solution, if a person feels uncomfortable, they start to think they have the symptoms of the virus, rather than running down to the ER or dialing 911, we give them the opportunity to do what basically you're doing right now with me. The only difference is it would be through a HIPAA compliant video feed, and HIPAA is a fancy word for security about your health information over the internet, right? So we want to make sure your personal health information is protected. So it's a little bit more secure platform than a normal web meeting. But it does allow you to be in direct contact with a physician. In our case, it's typically ER folks or medical practitioners that are actual doctors. You can have physician's assistants as well help evaluate. But the nuances that a doctor can pick up from talking to a patient, the information that they can get through the kind of the interaction like we're doing now, can really help them say, wow, I think you are in trouble. Or hopefully, it doesn't seem like you're in trouble. Mm-hmm. And that's what the telemedicine side, offers the community. So when we were there, we had, local community members, again, business owners in the case of the hotel. We had the first responder whose personal message is very poignant because he's had friends go on calls. That's what they call them. It's a call. You get a call and they go. And they got there, and an older man that they went to see, he had the virus. They discerned that when they were with him. They brought him into a remote ER in the Sanford, Florida area. And by the time everybody figured out what was going on, 9 of the people that are first responders, all the way from the paramedic to the ER physician, were exposed to the virus in what they call chain of custody. Mm-hmm. And this left a gap in the workforce up in that area because these people had to go home, self-quarantine. They and their friends and family were scared for 2 weeks. And I think 2 of the 9 actually contracted the virus. Wow. So clearly, Dr. Husty, who's the medical director for that part of the International Association of Firefighters there in Central Florida, he's a great proponent of this program because he's like, yeah, if we knew we were walking into, a mess, we could have been ready. I'm not saying they're going to wear a hazmat suit, but they are going to be prepared to transport or treat. And in some cases, they may very well tell the people to quarantine at home and send medical help to them.
And so this is so helpful for so many people on both sides. How does one, get started doing this? What number do they call? Where do they go?
Sure. So one of the reasons we went with the URL, as you can see here in our banner, Go to Flu, versus a phone number, is experience we had here in the Palm Beaches with the National Guard and Florida Emergency Management Group. They published a telephone number. They said, call this number if you think you need a test. We're going to have the National Guard out at the spring training baseball field, which they did. And 375,000 people called that phone number.
Wow.
That phone number, right, it went to a telephone bank of 25 individuals, and they only had enough tests for 2,500 people. Mm-hmm. So the gap in the community of folks that were trying to get in to say, hey, I think something's wrong with me, get in touch with one of the members of the telecenter to say, here's what I think is wrong with me, and then get an appointment. There's probably, even if everybody called twice, so 375 divided by 2 is, I have to do my math, but it's like 180,000 people, yeah. Right? So a lot of them didn't ever reach a physician, never got in touch with anybody, and actually left the program rather than feeling empowered, frustrated. And you could see that all over social media. So what we're interested in doing with a simple URL like Go to Flu, it helps people understand. If you come to the website, you fill out the information, we're going to get back in touch with you via the internet, which is basically email, but we're also going to have someone reach out to you and set your telemedicine appointment and show you how to log in and get to the point where you're looking face to face at a professional who's been trained to interview or evaluate you to determine whether or not they think you need a prescription. So the simple answer of how to get started would be the educational phase, which I think we're sort of doing now. Mm-hmm. Tell people about the program, give them a simple URL they can remember, and then, get them to the site so we can start making a contact with them that is reportable, trackable, and measurable.
And so once you do get on, so they do it kind of like this, right? They like video chat. Okay. So once we do get on and, all their symptoms are kind of saying, they might have the virus, then what would you guys do then?
So then the physician that the individual is in touch with would give them, through this evaluation, a prescription. Exactly like it would happen if you were physically in the ER or physically at your local doctor's office if it was open. Mm-hmm. So they would evaluate you, they would give you a prescription, and then you take that prescription and you get a test. That's the next step.
Okay, cool. And so I think in our email that you guys sent to us, you guys said you were treating a COVID patient through telemedicine, right? Could you tell me a little bit about the whole situation and how it's going and everything?
Sure. So we want to make sure to delineate certain words like treat versus evaluate. Okay. And so we're evaluating people through telemedicine. What we find is that if you actually have what's called medical necessity, then you go to the head of the class, either at the National Guard Center or at one of the nonprofit outlets, or if your personal health insurance in connection with the medical providers you work with, if they can provide the test, or in our case with the laboratories we work with, we require a prescription because it prevents us from using the limited number of tests on people that don't need them. Mm-hmm. So in our case, we've had multiple people that have needed the test. We've sent them to a variety of locations, some that are at the ball field, some that have been mailed into a lab like Quest or LabCorp. I actually personally did a telemedicine visit for a test run, but I did it with Johns Hopkins, right? So we got on, it was just like this, except the person on the other end of the camera was a Johns Hopkins physician. They interviewed me. They said, Mr. St. John's, I'm glad to tell you that we don't think you have the virus. So sorry you don't feel well, but we don't have any concerns for you. But in the case of people that do get the test or need the test, the prescription gives them a medical validity. So this way they can go to the head of the class, or they can have a kit mailed either to them or their doctor near them, which is the collection kit. So you've probably seen the uncomfortable looking images of having the swabs stuck up your nose, right? So it's not good, but it is what you do. So telemedicine obviously can't be involved with the part where someone is literally taking a swab and putting it in your nose. That's either something that's done in a drive-up scenario through a car window, you'll get handed a kit, or it's something that can be done if your practitioner is willing to meet you at the office, or if his office is open, can mail it directly to your doctor, or you can come to a clinic or to the ER in this case where they're prepared for you. They administer the collection side of the test, which is basically, again, a swab. Typically 24 to 48 hours later, you have the answer as to whether or not you do or you don't have the virus. And then from there, there's a variety of treatment options that your physician can give you based on your personal health situation, which has a lot to do with, you know, your demographic, how old you are, do you have any other extenuating conditions, like respiratory conditions or things of that nature. If you're pregnant, if you're elderly, some of those conditions can come to light. And then your prescribed recovery process is really becomes something between you and your general practitioner.
And how many times do you guys call each other or FaceTime? Does that just vary, or do you have, like a rough estimate of if someone does have the virus, they probably talk to each other every couple of days?
Yeah, so we find that the individual client slash physician relationship, again, it's tailored because by this point you're literally talking to a doctor. So if it was someone like myself or someone like yourself, that's relatively young, relatively healthy, he might say, hey, take rest. We're going to monitor you. I'll talk to you again in a couple of days. If you feel like anything bad's happening, give me a shout. But if it was someone like the gentleman in Sanford that we spoke of, who actually had CPOD to start with, which is respiratory, then they can monitor them on a daily, and in some cases, multiple times during the day, because by the time you get connected, it's just like answering the phone or doing a FaceTime visit. So once that application has, come to light in your personal life, and depending on the family environment, I use my father as the example. So if my dad, he would get on once, my sister would have to do it for him. And then every time thereafter, my sister would have to do it for him, no matter how many times we told him how to do it, right? He's just an old guy and he's not going to do technology very well. But the beauty of the telemedicine application is that it can keep you in touch with your physician from the comfort of your own home. And in some cases, it's the comfort of your own bed. And that way they can talk to you, feel out how you're doing through the interpersonal action. And then from there, they can decide whether they need to see you again, whether they think your condition, for example, is worsening to the point where we need to get a medevac over and get you to a hospital, maybe get you to the ventilator. And then, of course, we're all familiar with the set of drugs that are coming online and, of course, the vaccines that are being worked on.
Do you have an estimate about how many patients you think you see like online day to day? I bet you can see a lot more, right?
Yeah, you can. Yeah, you definitely. The thing that a telemedicine visit does for efficiency is it takes all of the action that occurs around a patient coming into the front desk at an office, saying hi to the receptionist, sitting down and waiting, walking around to get in the room. Then the doctor's got to come to your room, and typically in person, there's a lot more bedside manners. So you'll be more likely to engage with the patient longer. And in some cases, that's great. But if you're just strictly gauging efficiency, once you're on a telemed visit, it's typically, hi, how are you? Let's get started. Right? Because people are just more accustomed to that. So yes, it absolutely provides the opportunity for, instead of 2 or 3 visits in a given hour, a physician can do 4 or 5 in a given hour.
Wow, that's cool.
Mm-hmm.
And this even beyond COVID-19, you know, like, do you think telemedicine will probably be the next new thing? Like, will this probably take
I
off? You know, it seems like it's kind of smart, even with any other virus, even if it's not COVID-19.
Well, yeah, there's a couple of ways to look at it. On a personal note, I have a 7-year-old. He got an antibiotic. On the third morning of having the antibiotic, he had broken out into a rash. So my wife said to me, "Hey, you've got to watch the other two guys. I'm going to have an appointment at 11." So I look out my window. I work from home, and I see them out in the yard. So I go out and I say, "Hey, it's almost time. Aren't you going to the doctor?" And she goes, "Oh no, we're going to do it over the phone." So I went, "Oh, we're going to do telemed. Great. Okay." So a few minutes later, I check in with her, and she said, "Yeah, we were number 4. We're number 3. We're up next." And so the physician gets on, and we start to talk, and then my wife turns the camera on to our son, and she's literally, the doctor says, "Oh, did you give him amoxicillin?" We hadn't even mentioned the type of antibiotic, but by seeing him and seeing the rash, which to us looked a little bit like chickenpox, so we were like, "Oh man, I hope it's not chickenpox." And she already knew right away it was amoxicillin. She said, "No problem, we'll change the prescription," and we hung up. About 3 hours later, we got a text message from CBS Pharmacy. We went down and got the new antibiotic, and my wife and I both went, "Wow, I'll never go to a doctor's office again unless I have to." So what we're going to find is just like with email and just like with FaceTime and Facebook and the other technologies, as people become aware of them and then begin to adopt them, and then they find out that, wow, this works, and I don't have to get in the car and drive to the doctor's office and sit there for 45 minutes. If he's a little late coming into the waiting room, I can still watch Netflix.
I hated
Or
that part. The
right,
waiting room.
right.
I was
Or I can, right, I can clean the house, I can keep working. There's a million things you could do besides just sitting there in the waiting room. And I think that level of effectiveness is what's going to drive the continual adoption of telemedicine in general. Then we have another kind of technology leap that we're all aware of. It's called 5G. And 5G is going to enable a whole new pantheon of activities. So for example, one of my clients is a podiatrist. So imagine you're sitting and you hurt your foot running. The next day, a box shows up in the mail. You open it up, you stick your foot in it and seal it around your ankle. Use your iPhone and go click. You take your foot out. You send the x-ray back to the podiatrist, you close the box back up, and you give it back to the Amazon driver, and he takes it away. Voila, there's an x-ray of your foot. So the type and kind of applications coming online through companies like Apple in conjunction with companies like GE Healthcare and other providers, it's going to explode. So I think the numbers are as much as 60-70% of your routine doctor visits could be done over telemedicine. And with the advent of new applications and the increased smartness of the smartphones, you'll find that more and more people use it, and it becomes more and more a prevalent part of our life.
Wow. I mean, I think I covered everything. Do you guys have anything that you would like to add that, we missed that is important to this?
I really, if I did anything, I would just like to make a statement so that it might fit into a quick, sort of a 10-second news bite. And it would just simply be, if you think you have something wrong with you and you're not sure what you need to do, then protect your first responders and let us come and see you. So please go to Flu, fill out a form, and let one of our physicians meet with you over the phone.
Mm-hmm. Yeah, and we could save a lot of time and a lot of people coming in contact. Wow.
Absolutely.
Cool.
Yeah,
Maybe
it's
I don't
good.
go to the doctor anymore.
I hope you don't need to go.
Yeah,
but if you did, your yearly checkups and things like that, dental, believe it or not, have you ever held your phone up to your teeth? Just for fun, or you've